Hello, I'm John McKay, and I'm the Member of Parliament for Scarborough-Guildwood, and I'm here with my friends Mitzi Hunter and Paul Ainsley, and some special guests, Liz Buller, Michelle James, Lieven Gemkreel, and Jenny Joachim. And we are going to talk about some pretty important things tonight, particularly how Scarborough is dealing with the pandemic. So with that, I'm going to turn it over to Mitzi for a brief introduction, and then to Paul, and then we'll get into the talking to our guests immediately.
Thanks, John, and it's really great to be here to hear directly from our constituents on our virtual town hall. And I know that we are in stage 2 of the pandemic here in Scarborough, and everyone has concerns about health and what's happening with the current state of the pandemic. So tonight's panel are all here as experts in that area, and hopefully we can answer your questions. You can certainly reach out to my office at any time. We are working through the pandemic. You can email, phone calls, or we're scheduling appointments as well. So terrific to be here, and I'll turn it over to Paul.
Thank you. Thank you to Mitzi and John and everybody and all of our guests for being here. This is, I think, our 5th town hall meeting. Been very well received. I think we have one tonight that's very relevant to everyone. Everyone very concerned. Lots of questions during the current COVID pandemic, and I want to thank everybody for being with us this evening. Thank you.
Thanks, Paul. And you're first up with questions to Lieven. So we're going to. The format is going to be that Paul will ask Lieven a question, and Mitzi will ask and Jenny a question, and I'll ask Liz and Michelle a question. Then we're going to open it up to public questions.
I have a different list, John.
Oh, well, make it up then.
All right. This is an easy one then. Where can people, the question I get asked the most each and every day, where can we get a flu shot?
So that question is for me. Good evening. My name is Lieven Gemkreel. I'm the Executive Director of Taibu Community Health Center. We are based here in Scarborough, in the Malvern neighborhood, but we serve the whole of Scarborough, the GTA, particularly with the Black population. And we also have a focus on Indigenous and Francophone communities in Scarborough. So I'm very pleased to be here with everybody in the panel, and thank you for the invitation. With regard to flu shots, actually with the partnership that we have with all the partners at the Ontario Health Team, we are actually getting into a partnership of delivering flu shot satellite spaces at different places in Scarborough, whether it's going to be in residential places, the malls, and we're also offering flu shots in our centers. And I believe pharmacies are also providing flu vaccines. So those are the places where people can access their flu shots this year. It's very important that everybody takes their flu vaccines this year, particularly because of the situation that we'll be facing.
Mitzi?
Okay, that's great. Thanks, Lieven. And I have a question for Jeannie, and Jeannie is the CEO of the Scarborough Centre for Healthy Communities, and you provide services to many of Scarborough's vulnerable and marginalized people. I know that when I visited, you do the Meals on Wheels programs, you run the food bank in Scarborough. So can you speak to, one of the food banks that we have in our community. So can you speak to the impact that your organization sees to these, has to these communities, and how the SCHC has been able to respond in light of the pandemic? What's happening there?
Thank you, Mitzi. Happy to address that. You hit on one of the main impacts that we have seen, definitely related to food security. Our food bank alone has seen twice as many folks this year versus last year in families. So over 6,000 individuals since the pandemic started, have actually registered and been accessing food. And we've had to do that with different capacity, given that a lot of our volunteers have not been able to support that work. Meals on Wheels is another form that has really been supported around food security. We're continuing to provide lots of need there. Similarly, pop-up food banks across Scarborough have been needed to be supported. In addition, though, to food security, we've also seen a real need for supporting folks with mental health and wellness, and real impact there, heightened anxiety related to COVID, social isolation from all age groups, and really targeting programming and wellness calls. Real harm reduction, so number of folks in Scarborough high-risk population, so we were able to convert one of our transportation vans into a mobile harm reduction unit so that our team could go into the community and really address health equity for this community. Like many others, we've had to shift to virtual programming, so while we were still able to provide some face-to-face visits like the food bank, Meals on Wheels, within our primary care, a lot of what we had to do was shifted for the wellness of individuals to virtual, but that created its own challenges. So while it also tested some presumptions and theories around who would be able to use virtual technology, we also realized that it also created barriers for some folks, and that you can't just completely eliminate and go virtual, and in looking at ways to address that great divide, both from a technology perspective and trying to get technology to individuals, also looking at access to Wi-Fi. So for much of the communities that we serve, even if they maybe had a smartphone, for example, they would access free Wi-Fi in locations like the Tim Hortons, the McDonald's, the libraries, and those locations were no longer available. And so we were able to kind of reach out for some folks and be able to provide limited data packages so that they could benefit from the virtual programming, but also address aspects of isolation where they weren't able to see loved ones be using the technology that was there. The other concern and focus is really around some of the preventative work. And so our primary care physicians and providers have been really focusing on how do we maintain the wellness for individuals who may have coexisting conditions, cancer screening that is so important. We know early detection is critical, but that's been greatly impacted. Doing a lot of education, even in terms of as things got better in the summer, we were able to return or try to return more face-to-face in-person visits. We understand, we saw a lot of the communities saying, actually, we're not ready to come back. And even as you educated around the safety and the precautions that were in place, prefer to continue to access some of those services remotely. And most recently, our bereavement program has shifted to also address some specific programming related to bereavement during COVID. As we know, unfortunately, we've seen too many deaths, and trying to support the community in that perspective. Lots of preventative education, social media campaigns. We now have a TikTok account to reach the youth. I'm not an expert in that, but we have a team that is helping with that to try to really target different patient populations. And the last comment I'd add at this point, or second to last, is really working in partnership with our community leaders, because we do see that cultural divide as well. You know, that not just a need for translation, but education around, if you are sick, it's okay to stay at home. We work with a lot of communities where the work ethic and the need to come to work is really important. And trying to launch a campaign as an example to say, if you are unwell, please don't come to work. And not just for our staff, but for the broader community, but partnering with community leaders who have a voice, who are recognized within that element. And lots of partnerships. None of this work can be done without partnerships. We even spoke to the flu clinic, and we've come together and providing, in addition to all the primary care providers, currently over 30 flu clinics out in the community as well in our organization. So lots of good work going on. I'm going to pause and maybe let some of my other panelists speak to comments.
Thank you. Thanks, Jeannie. I can see a TikTok video on mask wearing. I can see that
Yes,
working. Thank you. Over to you, John.
Thanks, Mitzi. Thanks, Jeannie. Good to see Liz and Michelle again, even if it is virtually. So, Liz, you are the head of the Scarborough Health Network, the third largest health network in Ontario. And the last time we talked about this subject, I asked this question, and so I'm going to ask it again. Back then, you knew that there was going to be a second wave. And so the question was, why should the people of Scarborough feel that we're better prepared for the second wave than we were for the first wave?
Thanks for that question, and thanks for inviting me back. And I'm so pleased to have Michelle James, my Vice President of People and Transformation, joining me tonight. All the work she does, but also our colleagues Jeannie Joquin and Lee Van Germichael. It's such an incredible team. And as many of you know, we've been working together to build the largest Ontario health team, the Scarborough Ontario Health Team, and moving forward exponentially on that, working together, which really is helps me answer your question. In wave one, we were cutting trail. We didn't know what was in front of us, and frankly, we're still cutting trail, but we learned a lot from wave one about how to handle wave two. And I really feel for the people of Scarborough that we are in an excellent position to be supporting the safest care for the community that we have. Our hospitals are safe. We have incredible infectious disease physicians, incredible IPAC teams, incredible environmental services teams, incredible team of nurses, our critical care centers. Everyone learned a lot. People will think, oh, there was a bit of a dip during wave one and wave two. I can tell you our teams were working flat out the whole time in addressing wave one, but also how did we learn from wave one to pre-plan and get ready for wave two. And so while other people might have been having vacations in August and taking a little bit of downtime, our team was already starting in our pre-planning on how to manage wave two. And I think we are experiencing higher volumes in other areas, no question, with regards to our community. I think second to Mississauga, we go up and down, but we're managing it very, very well. We declare outbreaks. We're being as open and transparent with our community as we possibly can be. The community will have heard we've had 2 outbreaks recently at our general site. And outbreak is, for people to really understand, and I am not an infectious disease expert, nor do I pretend to be. I'm a nurse by background. An outbreak is 2 patients that are epidemiologically linked. So when that happens, that there's been evidence of contact, then we declare an outbreak and we heighten above our already exponential infectious disease protocols to make sure we can make it as safe as possible, and we want to continue to make the community safe as possible. What I would say is, despite the 2 outbreaks that we have at our hospitals across Scarborough, our hospitals are very safe. And I want to make sure that people know that it's safe to come to our emergency departments, safe to come into hospital if you need care, and that we are very well prepared, better, no question, than in wave one. We've put in many, many mitigating procedures. We had 4 bedrooms. 4 bedrooms are no longer part of our structures. We've converted those to make them 3 beds and 2 bedrooms. We cohort patients in a different way. This is way too much language for a public town hall. But I want you to know we learned a lot, not just from wave one, that we built on from SARS and other learnings that we brought forward, and then from COVID wave one into wave two. And I'm very confident with the practices we have in place that we are keeping our community as safe as possible.
When you say an outbreak is two people, can you, that initially strikes one as passingly strange, two people. I'm assuming that two people means two people with networks of people.
Two people means two people that are positive with COVID. And so we assume, of course, that then there is, then the contact tracings of where does that go? And that's why we make sure we shut that down very, very quickly. I won't get into all the epidemiology of it or the infectious disease parts of it because it's not my area of expertise. But two people, absolutely to your point, is yes, every one of us has a network, and that's the contact tracing pace that we need to make sure we follow through on.
So it's an intersection of two networks as much as it is two people.
Yeah,
Sorry. I was just, I don't want to dominate the time here because I've literally got a ton of questions that the public want to ask. But the outbreak last time was focused in a lot of long-term care homes. You've taken some supervisory responsibility for those long-term care homes. What assurances can you pass on to the people of Scarborough that their loved ones in long-term care homes are not going to be subject to the same mortality rate and infection rate that we saw in the previous outbreak?
Sure, thanks for that question. I actually can't pass on guarantees of anything of that nature, and I don't think anybody could, that we won't see infection rates or mortality rates. But our goal is to make sure we don't see those kind of infection rates or mortality rates for sure. And what I do feel is across Scarborough, we have responsibility in Scarborough, not responsibility, but we help to oversee 20 long-term care homes. These long-term care homes, we've been getting together with every 2 weeks and sharing our learnings and new practices and what we should be doing, how we can support each other since within the first couple of months of wave one. And it's been an incredible experience of these teams coming together and really all of us building an integrated partnership around sharing leadership, sharing infection control practices, our physicians, our frontline available for them, our professional practice leaders, our environmental service support people. We have sort of a menu of options, whatever is needed for the long-term care homes. At the minute they feel they need supports, we are there. And so we've really created what we call a rapid response team, and also in addition to that, a hub and spoke model that we're working in a much more integrated manner. And that sounds like a whole lot of admin speak. So let me just say, what that means is the long-term care homes, they can call us on a minute's notice, and we will work to find a plan to go in and make sure we can make sure if there's any gaps and they need supports that we will be there for them, whether it's staffing, physician support, infection prevention, control, and or any of the other areas that we're working in. It couldn't be a much more integrated fashion than ever before. And I'm very, very proud of the work that people have done. People have been working flat out 7 days a week, I would say, over the last 9 months to make sure we take our long-term care homes, everyone, as part of our whole Scarborough community. We don't want the patients having to come to an acute care facility if we can manage them in what's really known as their home, in long-term care as best we possibly can. And so building these bridges, we've learned a lot, and I think they've learned a lot, and we've built great relationships together. We had 2 homes that we had oversight for. We've been able to transition those fully back to the management of the long-term care homes. They've got great practices back in place. And it really has been about having shared learnings together to make our homes, which are homes for our seniors, as safe as possible.
Thank you, Liz. And I want colleagues to jump in here. That question was actually from a person named Selvi Krishndathan. And I'm hoping that that will be of some comfort to her. I don't know whether Mitzi or Paul want to jump in here, but I was quite interested in Liebman's comment about flu shots. It strikes me that we are, the Premier goes on television and says, well, everybody should go out and get a flu shot. And then when you phone up your doctor to try and get a flu shot, or your clinic, as the case may be, or a pharmacist, as the case may be, well, we haven't got our doses in yet. So what comfort or responses can we offer to people about a flu shot, which is obviously in this time of year extremely important? I don't know, Mitzi, do you want to launch that one? You have to go off mute.
Thank you, John. Yes, absolutely. So we want everyone who would like to have a flu shot to receive one. The province has ordered 700,000 more flu shots than in prior years. So we have 5.3 million doses of flu shots. I know that one of the questions that came in was, have we prioritized long-term care, seniors, and hospitals? And we have in the first batch of the flu shot that has come in. There has been some prioritization. And at the same time, pharmacists, primary care offices have also received dosage, and people are being encouraged to book an appointment. You can book an appointment with your pharmacist. You can book an appointment with one of those 30 locations that Jeannie mentioned. I'm hopeful, actually, that we can maybe get access to those 30 locations and send that out or post it, so that people in our community in Scarborough can figure out where they can book their flu shot. Remember that flu season is quite long. We're just at the beginning, and as more dosages do come in, the pharmacies and primary care will be restocking as well. So even if it takes a few weeks for you to get your appointment, please book those appointments.
Liebman and Jenny, do you I don't know whether either of your organization, Taibu or Scarborough, do flu shots. Do you have sufficient?
Maybe I can jump in, Lieben, and then let you go. So to one of Mitzi's comments, I posted in the chat, and we'll send a link that all of our partners have come together that lists all of the information that keeps getting updated as to locations and time for the flu shot. So we are confident we will have enough. We keep getting supplies. So we started with the high risk in terms of our healthcare workers to make sure that our workforce was protected, and have now started some of the community clinics. I think it's unprecedented and understandable this year that folks are very interested in receiving the flu shot, and that's a very positive thing. And so there's a bit of that patience that needs to be required, but we're receiving regular supply and are making that available through the community clinics as well.
Lieben?
Yeah, it's the same thing, what we're doing is we continue to receive stocks for the vaccines. We are prioritizing our vulnerable clients initially, and then rolling it out to the community as well. And as Mitzi was saying earlier on, this is the beginning, so we continue to push. There's a lot of education and engagement that we have to do with certain community members who are sometimes reluctant to take flu vaccines. So we're also working on the outreach, the education, the awareness, to encourage people to take the flu shots. I mean, we do that every year, but particularly this year, knowing that it's a difficult year for everybody. So we do that as well in terms of engaging, outreaching, and encouraging the communities to be taking the flu vaccines.
Does Taibu actually administer shots?
Mr. McKay, if I could just ask, maybe Michelle James could just jump in on this too, because this is a really great example of how the Ontario Health Team that we've put forward has come together with Lieben and Jeannie and Michelle. And they've all been leading this together, but it's an area on the flu shot both last year before we were formally in OHT waiting to be a formal OHC. Just this year, hearing that that's imminent. There's been a lot of work done around, and this is just a really great example of that. So Michelle, maybe you could speak to that a little bit.
Sure. Thank you very much, Liz, and good evening, everyone. As Liz mentioned, this is the second year now that we have leveraged the collaborative expertise and resources of our healthcare providers that are part of our Developing Ontario Health team. And we took a real population health approach because we know that there are some communities that are more vulnerable than others when it comes to susceptibility to the flu, and also some communities that experience barriers to access more than others as well. So we took a targeted approach and we looked at our data. We looked at the communities that have, for example, a relatively high percentage of seniors or have a relatively high percentage of low-income households. We also looked at data from the hospital to understand which neighborhoods, which postal code areas had seen the most discharges from hospital related to the flu in the previous year. And then we worked with public health and we put all of these things on a map and saw where our riskiest neighborhoods were. And then we said, well, public health, where are you going to set up your flu clinics? And they told us, and we plotted those on the map. And then we said, well, where are the holes? Where are the gaps that we could fill? And then all of our partners got together and everyone offered their time, their expertise, their nursing staff, their mobile buses, whatever it took. And we went out and we set up mobile clinics in a number of high-risk communities. So basically bringing the vaccination service to the community instead of people having to travel to a pharmacy or to a doctor's office. And another really exciting thing is that one of our partners put us in touch with an organization called Socks for Souls. And they donated 1,000 pairs of warm socks to us that we received last year. And we've just got another 1,000 this year. So anyone that comes to one of our community outreach flu clinics for a flu vaccine will also be able to get a pair of warm socks for the winter. And that might not mean a lot to some of you, but it does mean a lot to some people in our community. So because of that, we have branded our initiative as Safe and Warm in Scarborough. And we're very proud of that.
The fundamental question is for all three of you. Do you feel you have sufficient doses in order to meet whatever demand that you experience?
So John, maybe I'll take a first kick at that on behalf of Scarborough Health Network. I think we will have. I think the demand has far exceeded, even when we anticipated doubling demand, the people wanting the flu vaccine. So we just kicked it off. We've ramped up asking for more vaccine, and I think we'll have it in time. I believe we'll have it in time to be able to address the need for sure. But the demand on a day-to-day basis, when people over the years we've tried to anticipate demand, has far exceeded, even though we anticipated that it would be higher given COVID. So some areas don't have as much vaccine as others, and people are shopping around. It will be there. I have every confidence we will have enough. It's just going to be the timing, and it'll be a bit inconvenient for some people who are trying to get that, and that's just trying to match demand with volume, and that's always a tricky thing. So I know there have been complaints and concerns, and acknowledge that, and I acknowledge the frustration when you set up a time. I know my mother sat and went through the phone book and drove 2.5 hours to another town to get her flu vaccine as an 80-year-old woman at a pharmacy in another province. And that just seems wrong. But we don't always get it right. But we're going to do the best we can to make sure everybody gets the vaccine that needs it and wants it. And we will. I have every confidence in that. It's just the demand upfront is has exceeded what we anticipated.
And I think
sorry, go ahead.
No, I was going to say part of the benefit of coming together as an OHT and the different partners would help us also to address those issues, because there's going to be a joint effort in delivering these in different communities. And I think that would also be helpful as we move forward to getting more stock and then continue to do that. So I think the coming together and sharing those resources would also be a good strategy of meeting the needs as we start the flu season.
Yeah, great.
I just hope your strategy doesn't go in the ditch because you're not able to get what you need in order to meet the expectations that in part you've created.
Yeah, well, we hope so too, and we'll be counting on you to help us with it as well.
Oh, we always go to the federal government. Well, I won't go to the provincial government here. Paul, have you got a question that you want to put to this very able panel?
I just wanted to jump in with, so I have been working with the City of Toronto's Medical Officer of Health, Dr. Davila, to help fill that gap in Scarborough. We're going to be opening a public flu vaccination clinic probably next week.
So here's a question from Vera. First of all, she thanks you all for the hard work that you've done. It says, my question is, why are the COVID numbers increasing all of a sudden? Is it possible that these individuals had the virus with no symptoms and unknowingly have spread the virus? If this is the case, why is testing not provided to every single person to identify such individuals? Who wants to take a run at that question? That's a very difficult question. Mind you, got to bear in mind, we have the top people in Scarborough asking these questions. So Vera deserves an answer. So, Lehman, you're looking like you want to take a crack at that question.
Do you want me to start, or?
I can't see who's saying that. Is that you?
It's Michelle, sorry.
Yeah. I think Michelle is the best person.
Oh, okay.
To
I didn't see it. I'm sorry, Michelle.
Yeah, it's a really good question in terms of why is this happening and what are we doing about it and the testing strategy. And I think we have to acknowledge that a second wave has been anticipated for quite some time. And as Liz mentioned in her answer to a previous question, we were ready for a second wave, and we had looked at all kinds of scenarios, some even worse than what we're seeing now in terms of the rise in cases. And this thing, when you turn on the news, you see that this is happening all over the world, not just in Canada, Ontario, or Toronto. So this is the trajectory of this particular virus. And we've learned a lot from wave one. So even though the volumes are increasing, I don't think we're seeing as much morbidity and mortality as we did in the first wave. And we've learned a lot about treatment modalities and how to take care of patients with COVID. So we're much better at it this time around. In terms of the testing, the province has promoted increased testing and invested a lot of money into assessment centers. We certainly were operating only 2 assessment centers in wave 1, and now we're operating 3 assessment centers. So one at each of our 3 sites, as well as going out and testing people in retirement homes, long-term care homes, group homes, schools, and we're looking for locations to set up pop-up clinics for the public in the community as well. And the addition of pharmacies is something that we're seeing in wave 2, with pharmacies testing asymptomatic individuals. So I think, and no one is turned away that comes for testing. So I think that's really important, that we are really maximizing the testing strategy. And what we're talking about now in Ontario, and certainly amongst our Ontario health team, is that actually taking the test is just one part. It's a very important part of it. But we're talking about a continuum of testing, tracing, isolating, and supporting. And we're paying attention to all 4 of those phases. And even before the testing, Liban and his group at Taibu Community Health Center, they're working with the hospital to find ways to educate members of our community, particularly those that are marginalized and racialized, and may not have all of the correct information about testing and why it's important and what it's like and what it feels like and how it's safe, etc. So we've actually hired 2 students, 2 universities, how we can educate members of our community about testing and encourage people that need testing to get it. And then even after people have been tested, they have to isolate, and not everyone knows how to isolate safely. And if you test positive and you don't isolate safely, then that kind of defeats the purpose if you're going to spread it to members of your household or others. So we have other healthcare providers that are focusing on ways that we can educate and the community about how to isolate safely, and also supports that people need after they've been tested, because the positive test result could have all kinds of implications. Obviously, there's health implications, clinical implications, but also financial implications. Well, if people have jobs, or if they have a particular living arrangement where they maybe are, share a bathroom or bedroom with other people, and they're not quite sure what their options are. So we want to not just do the test, but also support people through the whole process until they've recovered, so that they don't spread to other people. So those are some of the things that we're looking at from a testing perspective, and this is all based on lessons learned and research from what's going on in other countries. So I'm really confident that we're doing the very, very best we can under the circumstances. Although numbers are rising, we really are doing a great job. At Scarborough Health Network, we have the capacity to do 1,200 COVID tests a day across our 3 assessment centers, and we're mainly doing 900 or 1,000, and we're very proud of the fact that our wait time is only about 12 hours. In some communities, it's much longer than that. So it is very, very well served by the initiatives that we have in place.
So if Mitzi walks into Shoppers Drug Mart tonight, will she be able to get a test?
Well, unfortunately, I don't want to speak on behalf of Shoppers Drug. I believe you have to book online. I'm not sure if they're taking walk-ins at the pharmacy.
So we have we've posted the list of the pharmacies in Scarborough, and we can also reshare that list. And those are for people who don't have symptoms. Those are just for people who are asymptomatic and they have reason to believe that they might have been exposed to someone who had COVID, and they can book an appointment at select pharmacies to get a COVID test. I want to say the amount of public education that I just heard from Michelle and others' update is just remarkable in terms of the way that our health providers are managing the virus in Scarborough, and I just think it's remarkable, and want to just say thank you to you and your teams of people who are going out on the front lines doing this work. This is probably a good time to say to everyone that's listening, please download the COVID Alert app onto your cell phone, because it's another way to help to lower the spread of COVID-19. If someone that you have been exposed to tests positive, then you'll get an alert on your phone so that you can self-monitor and also seek to get a test as well. And it's completely private. It's not being tracked by your name or any other type of identifier. It's simply the application of the technology working in the background. So please download the COVID Alert app. So
here's a couple of questions right off the wire, so to speak. I can see my dentist, my optometrist, and my podiatrist, but I can't see my family doctor in person. Anybody got a comment on that?
At least I can speak of Taibu and our primary care providers here. If there is a need for our clients to come in and see their primary care providers, whether it's their physician or nurse practitioner or any other allied health professionals, they will be able to come in and see them in person. If it's not something that is very necessary to be seen in person, obviously they have the choice of either having a telephone conversation or virtual care or video conferencing appointment. But our providers have been assessing and making determination to bring in people, like well baby clinics or any kind of other appointments that are required to be physically. We do that with the appropriate screening and public health guidelines.
The same as Scarborough Centre for Healthy Communities, John.
Yeah. Okay.
I would just,
go ahead,
Scarborough
Liz.
Health Network, we're acute care, but we do have clinics so that if you cannot see, we've got great partnerships with primary care, but if you cannot see your physician, we are doing virtual care, but also we have rapid access clinics that patients can come into. Either do not see somebody. Please come to our emergency departments. Everything is completely safe. And I know there's concern out there in the public, but we also have rapid access clinics where you can be seen as well if you cannot get connected with your primary care physician. So I know many primary care physicians are doing virtual care first, and it's great and it's safe and it's very efficient. But if you feel you need to be seen face to face and you cannot get that access, please do not stay away from your hospitals. They are open.
I also want to add, John, because the province has, through the pandemic, made OHIP billing through virtual care possible, which is major leaps in innovation. So please contact your primary care. You could call your doctor and talk about whatever it is that you need to talk about and get the advice of your doctor in terms of the next steps. If you need to get diagnostic or any kind of test, those can be scheduled. And if you do need to see your doctor, oftentimes that can be facilitated as well. During the pandemic, like all other service providers, the encouragement is to do it virtually first, but it's not the only option.
Here's another question. Are there plans to further support frontline workers in long-term care and other high-risk locations as we re-enter another wave? And I don't know whether Paul wants to respond to that. I have to leave for 2 seconds. I will be back.
Yeah,
Go ahead.
Go ahead, Paul.
You're on mute.
You're on mute, Paul.
Thanks, Lacey.
Well,
I don't know if somebody else wants to answer that. It's long-term care homes aren't really my area of expertise or jurisdiction as a municipal city councillor. Can I let you have it, Liz?
I could jump in a little bit, and Michelle,
and I'll add to it after, Liz.
Sure. Actually, Michelle,
you.
You're probably way more adept at it than me, but I know there has been additional funding put forward for personal support workers to help support the extraordinary work that they're doing, at least until March 2021, amongst others. So, Michelle, maybe you're much more adept at it. So maybe I'll hand it to you.
No, that's a great place to start, because we know that in wave one there was money available. It was called pandemic pay that was available to all of the frontline staff in long-term care homes, and I believe it's continuing now for personal support workers specifically. And I can speak a little bit to Scarborough, because in my role of having oversight for human resources and occupational health and safety at the hospital, we have been lending our resources and expertise to the long-term care sector since April. And we actually meet on a weekly basis every Thursday at 2:00. We have a group called the Long-Term Care Incident Management System, and that involves all of the long-term care homes in Scarborough, along with public health, the hospital, the Ministry of Long-Term Care, the Ministry of Health, and we all get together and have a conversation once a week so that we are on top of all of the issues impacting long-term care homes. And we always spend time talking about staffing, talk about infections and infrastructure, but we also spend time talking about the people. And there's a variety of supports. There's, adequate PPE, personal protective equipment, there is educational supports. And the other kind of support that we've really been sensitive to is the emotional support for our frontline workers in long-term care home, especially those that have had outbreaks, and maybe they've experienced some deaths as well of residents. And we want to make sure that people are strong and resilient from a mental health and well-being perspective. So, for example, I have a team of spiritual care practitioners. Well, they used to be known as hospital chaplains many years ago. And we have deployed members of that team to go into a number of long-term care homes and just listen and support the staff from a spiritual and emotional perspective. So that has been very well received also.
Yeah, and as Michelle has said, the province has increased the personal support worker pay, and there are many reasons for doing that. We need to attract people to the field and retain those employees as well. So there is a $3 an hour increase in wages for personal support workers, and it's temporary. So right now it'll be until March 31st, 2021. But you can be sure that your elected member, certainly at the provincial level, is really pushing the government to make that permanent for these frontline care workers who are doing incredibly important work. As COVID has revealed our reliance on many frontline employees, including personal support workers and other workers who are in the care system providing that essential work. And we want to make sure we value those workers, that there's proper training, there's proper personal protective equipment, and that they have everything that they need to care for our most vulnerable seniors and your loved ones that are in those homes. And you might have seen earlier later last week, actually, the commission that is reviewing long-term care put out a report ahead of the provincial budget to really let the government know that more investment is needed in long-term care, both at the staffing level and in other ways. So, for instance, providing an average of 4 hours of minimum care for individuals in long-term care, so that they're getting enough hours in those homes to provide the level of quality care that you would want to see. The budget is coming out for the province next Thursday, November the 5th. It is expected to be quite a large deficit for the provincial budget to cover all of the pandemic-related costs. And one of the things that you want to look out for in the budget is investments in our healthcare, in our COVID response, in our long-term care.
I just see that our time is winding down here a bit. Paul, is there any question you feel you want to get in, or comment that you want to make before this is a superb panel, so might as well use them.
No, I'm fine at this point, John. Thank you.
Okay. All right. The questions are real when somebody asks. It used to be that there was free parking at the hospitals, and now those of us need to now need the hospital more frequently. The parking fees have returned. Are we in the midst when we're in the midst of a second wave? Is this set to change?
Guess I'll take the lead on that one.
I don't think anybody else is going to pick it up, because I know Jenny and Lieben have free parking.
Yeah, during wave one, we did open our gates to eliminate any parking fees to try to help offset more, both for staff and for families and others recognizing. And then as things seemed to calm down, we resumed parking fees just a few weeks ago in our organizations. As you know, across the province, it's completely high and low, but I think it's a really great question and something we will take back as something we may need to consider in wave two. Of course, for hospitals, and this doesn't help anybody out there who has to pay parking fees, whether you're staff or the public. Those are our minimal revenues to help us to pay for equipment and all the things that we have that are outside of what we receive from from our provincial funding and our federal funding. But we felt it was really important before, and I will take this away. Thank you for that question. We've only just reinstituted. We've always had parking fees. We relieved them over the wave one, and we'll revisit that for wave two. So thank you for that question.
I'm not sure you're really going to thank me for that question, but I'll take it anyways. But you do know that these are real questions when somebody asks about the parking fees.
Absolutely. You know, parking and office space, they're two of the biggest things I face. I got to tell you.
So one of the biggest things I face, and this will be close to the last question, if not the last question, is a real impetus to have the federal government set some national standards with respect to nursing homes. And I put that in the context of today's story from the CBC, which referenced a Scarborough nursing home where the standard of care was clearly substandard, shall we say. So I'd be interested in your thoughts on whether the federal government should exercise some supervisory or authority of some kind to start to set national standards.
Well, I guess I'll start there. Thanks for that question. It's a very big question, and I really can't answer it fully. What I will say is my bias is it shouldn't be about supervisory. It's about how do we make sure we're funding healthcare, and I believe seniors care falls under the funding care envelope, and that's the bigger discussion that we need to have in both our provincial and federal funding. How do we make sure that our seniors don't get, as seniors who require advanced healthcare living, whether it's in assisted living or moving into long-term care homes, have national standards. I do think that should be the same as anything else we have in healthcare. But that not supervisory. I do not like the role of it being about policing care. It should be about quality of care and standards of practice, and that those are set across the country. They should be national and provincial standards. No one should have a different level of care in Canada, and we feel that way in everything else we do in healthcare. And I think we need to make sure we carry that forward in our long-term care homes and care of our seniors as well. And I can tell you, many of us on this call, maybe Jeannie not so much, and maybe not Mitzi, maybe most of you, but some of us have crossed that bridge where we can see that window down the road. And I know I have family there, but that ready to receive long-term care, and those standards have to be set. They can't be, whether they're private or public. We can't be having that debate. It has to be the same standards. The private public should be in the background and never, ever be seen in the forefront of people who need to receive that care.
Yeah, I'd dearly love it not to be supervisory as well, but when you have a serial offender and people's lives and care is being abused, and there doesn't seem to be any willingness or capacity on the part of the current authorities to do the proper supervision, it still remains a live question. But I appreciate that here I am, kind of tackling you at the end of a panel. But I think this question carries on. What about Michelle or Lieben or Jenny? Do you have any observations with respect to that question?
I don't have to add. I'm very supportive of what Liz has said, and just our limited experience managing 2 long-term care homes during the first wave. We found a collaborative approach to be much more helpful than to come in with a heavy hand and say you must do this. And there was incredible receptivity on the part of the leadership in the homes that we managed to that kind of approach.
That's an interesting observation. Well,
I do just say, John, there would be real distinctions around the healthcare settings, like long-term care, assisted living, even in some instances, retirement homes are dealing with a much more aged and complex group than they would have in the past. I know the ones that I visited in Scarborough have told me so. And part of it is how to fund. We talked earlier about personal support workers, and there's also home care and community care that also delivers a tremendous value. And we do need to talk about how the system of care is standardized and funded as well. So I'm sure that will be part of the conversation that is had with the federal government and the provinces as well and territories.
I don't detect any wild enthusiasm on the part of the federal government to get involved in this, but the conversation is out there, and I have to say it is out there. And if my emails are any indication, there's a significant dissatisfaction on the part of the public with the current level and standards of care that's being provided. So let me just see whether Jeannie or Leben want to offer any observations on that, and after that we'll wind up.
Yeah, just a couple of quick comments that pick up on points already raised. I mean, our organizations are accredited against national standards, and that's what the goal should be there. The challenge is, though, that if you don't resource these sectors appropriately, you could have standards up the yin yang, but you can't resource them, then you're creating another problem. So they're not in isolation. I think the issue is an important one, needs to be looked at, and you need standards that are national, and they need to be, and the resources to support implementation of those standards, that you can then hold organizations accountable. Okay.
Leben, the last word?
Jeannie said what I was going to say.
Okay.
No, it's been said, so I don't want to repeat myself. Thank you.
Okay.
If I could just make one final comment, John, if you'll let me, but this is where the Ontario Health teams really come together, and it's really, everybody has rallied around seniors care. We all feel the same way. This is really, really important. And we can point a lot of fingers of blame if we want to. That won't get us anywhere. But what I've been so impressed with in the last many months through COVID is people really coming together to support everybody, but in particular our seniors, and right in there out of the gate with Wave 2 for our seniors care. And we have a couple of outbreaks already, and our teams are in there supporting them. The homes have called people straight up, making sure that the members of the homes are being cared for. So I think we're making progress. We've got a long way to go, and it does take a national strategy, a provincial strategy, but I really think we need to, at a time like this when all of us frankly are a little tired, to recognize the good things and the progress that we have made, and a little bit of the silver linings, if there are any, from Wave 1 that's moving into Wave 2 to help us make sure we're taking care of our seniors and one another.
Well, thank you for that. I know Mitzi has to leave, so we were just going to do a little wind up, a roundup. So because Mitzi has to leave, I'm going to give her the last minute, or the last first minute. and then you'll leave, and then we'll go to our absolutely, and I'm sure everyone will agree, outstanding panelists this evening. This has been really, really good. Mitzi.
Yes. Thanks, John. And I couldn't agree with you more. I am so proud of this team. What I'm hearing is that you're working as a system. You're working as a health team to protect the most vulnerable in our community and everyone in our community from a health perspective and from the threat of COVID-19 and the pandemic. And I want to say thank you so much, Liban, to your team at Taibu, and all the work that you're doing to really focus on it. You know, one of the things that didn't surface was the work you're doing on the Francophone communities. I know that's also an important part of our constituents in Scarborough, supporting members of the Black community, our seniors, and families. Certainly, Jeannie, your work is so critical. And and just when you spoke earlier, I was taking notes about, some of the gaps that you have identified. Everything is going virtual. Well, what about those people who don't have devices or who don't have internet? And, we've closed libraries or, places like the McDonald's or the Tim Hortons that used to have Wi-Fi. What is happening to people? Are they becoming more isolated? And we need to pay attention to that. And of course, our dynamic duo with Michelle James and Liz Buller at the Scarborough Health Network. Your language around community and partnering is really refreshing for the health network that you manage and working in collaboration. And I just want to thank you and all of the members of your team. So, as MPP and MP and councillor, we're really here to respond to the needs of our community. And right now, the number one need is to fight the pandemic and to make sure that people are safe. And that's what we want for each and every viewer that's watching, is for you and your family and for your loved ones to stay safe. If there's anything my office or I can do, please don't hesitate to reach out. You can reach me by email, mhunter.mpp.co@liberal.ola.org, or call my office at 416-281-2787. And my team and I are always there to help. I do want to thank the team on the back end of our virtual town hall, because they do all the work, even though we're up here up front. We're very well supported by the staff in our offices, and I just want to say a huge thank you to all of them tonight, and of course to my fabulous colleagues, John McKay and Paul Ainsley. Really enjoy these formats that we have each and every month. So I'm going to sign off, but until next month, or actually, I'm going to leave it to Paul to announce when our next virtual town hall will be, because it will be it'll be next month, but it'll be sooner than you think. And have a happy Halloween, everyone. Celebrate safely. We're not doing door-to-door trick-or-treating this year, but I'm sure you're going to find ways of making it fun and enjoyable, because we all have to have well-being and look after one another. Thanks, and have a good night.
Paul, do you want to do your wind-up on or the teaser for next time?
Yeah, so the teaser is actually, we're going to be having Mayor John Tory on our next town hall, which is next month, but next week, November 2nd. Monday, November 2nd, we're going to be having the mayor. And much as yourself and Mitzi, I want to thank the great team of panelists this evening. Having a pandemic, I think it's really brought a lot of issues to the forefront and concerns and how we deal with healthcare here in Scarborough. But I think, we have many resources, many different organizations that are looking after our residents and dealing with it. And I think it really speaks about the great community that we have here in Scarborough, that we've all come together so well, so strongly to continue to fight the COVID pandemic. And I'd just like to thank all of our panelists here this evening, and I hope everybody stays safe and well. Thank you.
And let me just sign off by thanking the people that have tuned in tonight and have sent us questions, etc. These are very valuable for we as practicing politicians, but also to the larger community that is trying to navigate us safely through this pandemic. So thank you, audience. This is our panelists will be interested in knowing that we're getting a lot of interest in what you folks might want to say. So stay tuned. We might call you back. So again, thank you for your service, and take care. Be safe.
Thank you, everyone.